Hello, I'm Dr. Lisa Belisle. You are listening to or watching Radio Maine, where each week we explore and celebrate creativity and the human spirit. We are sponsored by the Portland Art Gallery in Portland, Maine. This is the 17th episode in the Bountiful Path, a Radio Maine series. Today's reflection is called The Still Point. There are moments in clinical work that stay with you long after the details of the day have faded. Not because of what you did, but because of what you chose not to do. Moments when stepping back, slowing down, and allowing a silence to unfold created the conditions for something essential to appear. One of the clearest examples from my own practice involved a younger patient who had recently had a stroke. Before the stroke, he had been someone who relied heavily on his ability to think and speak quickly. Communication was central to his identity. His job depended upon it. His confidence depended upon it. After the stroke, the pathway between his thoughts and his spoken words became strained. His mind still worked with clarity, but his speech emerged slowly and unevenly. Sentences came in fragments. He would stop, regroup, and try again. I could see how difficult this was for him, and how deeply it troubled him to feel the distance between what he wanted to say and what he was able to express. During one visit, he was trying to explain something critical about his work. He started and stopped several times. He grew frustrated, and it was clear that what he needed most was not someone to fill the silence for him, but someone willing to hold the silence with him. So I waited. I waited without rushing him, without finishing his thoughts, without trying to direct the conversation. I waited in a way that told him he had time, that he did not have to push past the struggle to make himself understood. And eventually, he found the words he needed. Slowly and with effort, he told me that what frightened him was not simply the stroke or the speech difficulties. What frightened him was the possibility that he might lose the ability to pursue his calling. He worried that without clear speech, he would lose not only his position, but the sense of self that came along with it. Once he said this aloud, the entire landscape of our work together shifted. The issue was no longer simply neurological recovery. It was the preservation and reconstruction of identity. It was the need to recognize loss while also recognizing possibility. His truth had been waiting beneath the surface, and silence, not advice, had given it room to rise. This experience taught me something about the still point. It is not passive. It is a form of active listening. It is the moment when the urge to respond is replaced with the willingness to witness. And it is often in that space that people finally say what they have been holding. I have encountered still points in many other places beyond the clinic. On walks with my dogs, when the pace of my steps slows down enough for my thoughts to rearrange themselves. In the early mornings on our island, when the light filters through the windows in a way that makes everything seem more spacious. In the evenings, after the house has grown quiet, when the day's concerns settle into something more manageable. These moments have never arrived because I demanded them. They have arrived because I finally paused long enough to notice them. Writing has taught me this too. Some of my clearest insights have come not when I tried to think harder, but when I stepped away from the page long enough for clarity to catch up with me. Stillness is often the partner of creativity. It is the place from which understanding emerges. Leadership, similarly, requires still points. In times of rapid change, when competing needs and decisions can feel relentless, the instinct is often to move quickly. But I have learned that the most grounded decisions come from moments when I allow myself to slow down, to listen, to ask what is actually needed rather than what seems urgent. These pauses are not luxurious, they are necessary. I have witnessed patients reach their own still points as well. A woman in her 70s who, after years of caring for others, finally admitted she was exhausted. A man adjusting to life after retirement who told me that he felt unanchored without the structure he once had. A young parent who whispered that it was harder than they expected. These admissions never came at the beginning of an appointment. They came in the quiet moments after the initial details had been shared, when the deeper truth finally felt safe enough to surface. Stillness is where honesty lives. When I think about the still point in my own life, I often return to the moments after my father died. In the weeks that followed, life moved on around me. Emails continued to arrive, responsibilities continued to surface, but inside there was a quietness I had not expected. It was not numbness, it was a sense of everything being rearranged. There were many times when I sat in silence simply to feel the shape of this new reality. My father had been someone who listened deeply. His patients remembered this, his residents remembered this, and in the stillness after his death, I began to understand the full impact of his presence. He modeled the kind of listening that creates change, listening that steadies the room, listening that allows others to speak their truth. I carry that with me. So when I speak about still points, I am not simply speaking about rest. I am speaking about presence, about the moments that reveal what we're actually feeling beneath what we are saying, about the breath we take before moving toward what comes next. Stillness is not the opposite of motion. It is the grounding beneath it. So this week, I invite you to find one still point in your day. It may be a moment before you open your computer. It may be the pause at a stoplight. It may be the breath you take before answering a difficult question. It may be a quiet moment when you hear yourself think and recognize something true. If reflections like this resonate with you, I hope you will join me on the Bountiful Path, my newsletter on Substack, where I write about presence, creativity, and the quiet wisdom within ordinary days. I'm Dr. Lisa Belisle. Thank you for listening to The Bountiful Path, a Radio Maine series sponsored by the Portland Art Gallery. May your still point meet you with exactly what you need.